Chronic respiratory failure. Etiology. In health, the arterial partial pressure of carbon dioxide, PaCO2, is maintained within a narrow range by adjusting alveolar ventilation to match the fluctuating rate of carbon dioxide production. Respiratory failure results from a disorder in which lung function is inadequate for the metabolic requirements of the individual. It can be classified into two types. Type I respiratory failure. This is characterized by a low PaO2, less than 8 kPa, and normal or low PaCO2. It is mainly due to diseases that affect lung parenchyma with hypoxemia due to right-to-left shunts or ventilation-perfusion mismatch. Such conditions include pneumonia, pulmonary edema, acute respiratory distress syndrome, fibrosing alveolitis, and pulmonary embolism. Type II respiratory failure, also called ventilatory failure, it is characterized by a low PaO2 and a high PaCO2. This occurs when alveolar ventilation is insufficient to excrete the carbon dioxide produced by tissue metabolism. The most common conditions include chronic obstructive pulmonary disease, COPD, obesity, chest wall disorders, respiratory muscle weakness and depression of the respiratory center. Both types of respiratory failure may be acute or chronic depending on the speed of their development. Inadequate ventilation occurring acutely will result in a low PaO2 and a rising PaCO2, which will result in the lowering of blood pH, respiratory acidosis. A chronically raised PaCO2 is compensated for by the renal retention of bicarbonate and, as a result, the pH returns towards normal, compensated type II failure. This can be called chronic respiratory failure. Chronic respiratory failure. Chronic respiratory failure can be due to COPD, chest wall disorders, disorders of the diaphragm, obstructive sleep apnea, obesity hypoventilation syndrome, disorders of respiratory muscles, respiratory center inhibition, diffuse parenchymal lung diseases. Chronic lung diseases such as bronchiectasis, cystic fibrosis, and sarcoidosis. Occupational lung disease. In fact, chronic respiratory failure can be the end result of any chronic lung disease. Assessment of patients with chronic respiratory failure. Patients with chronic respiratory failure may have one or more of the following features. Use of accessory muscles of respiration. Tachypnoea, tachycardia, sweating, pulsus paradoxus, inability to speak. Signs of carbon dioxide retention, bounding pulse, headaches, peripheral vasodilatation, flapping tremor of the outstretched hands, confusion, drowsiness, and papilloedema. Investigations. Diagnosis of chronic respiratory failure is simple. An arterial blood gas measurement will establish the diagnosis. However, it is essential to arrange other tests to find an underlying cause. CXR. Lung function test. Ultrasound of the diaphragm. High-resolution CT scan. Treatment. Treat underlying disorder. Controlled oxygen therapy. Non-invasive ventilation.